Hi, my name is Molly Haller, and for my presentation, I researched federally qualified health centers. So, first, I thought I would start by describing what a federally qualified health center is, and it is a special designation granted by the Bureau of Primary Health Care and the for Medicare and Medicaid Services. It's given to nonprofit, public, or private clinics situated in areas lacking adequate healthcare services or serving populations with limited access to healthcare. So, what do federally qualified health centers do? They offer a wide range of primary health care services to patients, covering preventative, acute, and chronic care needs. This includes services such as vaccinations, screenings, diagnoses and treatments, and management of chronic conditions. In addition to this, they also provide supportive services aimed at addressing the various needs of their patients. FQHCS have a mandate to serve all patients irrespective of their ability to pay. This means that they offer sliding fee scales or other financial assistance programs to ensure that even those without insurance or with limited financial resources can access care. They often collaborate with other healthcare providers, including private practices and state agencies, to improve access to care, enhance care coordination, and achieve better health outcomes for patients. These collaborations may involve sharing resources, expertise, and best practices to address the diverse needs of the community. So, for the first article that I read, it discusses how states across the nations are working to enhance the performance of Medicaid primary care providers to control costs and improve the health of beneficiaries. One strategy involves the development of medical homes, with more than 37 states implementing or planning initiatives to improve primary care delivery. However, many small to medium sized practices lack resources for complex care coordination and other services needed for medical home models. Federally qualified health centers are proposed as potential partners to address these challenges. By connecting FQHCS with other Medicaid providers, states aim to improve patient access to services and reduce costly hospital visits. The article has three collaborations between the states and federally qualified health centers. First is the Montana Health Improvement Organization. Their program employs care managers to coordinate services, resulting in cost savings and extended care management services to a broader Medicaid population. Second is Community Care of North Carolina. Their network provides various services, including patient education and disease management, resulting in cost control and improved health outcomes. Lastly is Indiana's Open Door Health Center. Through referrals, the center helps patients establish a regular source of primary care, contributing to improved access to care. Down below, right here, Table 2, it highlights the key arrangements and characteristics of the projections in Montana, North Carolina, and Indiana. So, in conclusion, the creation of community-based networks involving FQHCs presents a promising approach to improving Medicaid primary care delivery and controlling costs. FQHCs, with their infrastructure and expertise, can play a vital role in helping practices function as medical homes and ensuring the delivery of high-quality care. So, for Article 2, the second article that I read focuses on assessing the impact of health disparities collaboratives, a large-scale quality improvement intervention on patient care and organizational function within federally qualified health centers. The researchers aim to determine whether the HDC generates significant positive or negative spillovers beyond its intended focus area. They explore how the intervention affects both HDC and non-HDC patient care, as well as FQHC function. Most respondents perceive that the HDC intervention somewhat or greatly increased the quality of care provided to the patients with chronic conditions emphasized by the HDC. Nearly half of the respondents indicated that the HDC increased the quality of care delivered to patients with chronic conditions not emphasized by the HDC, particularly for routine screening needs. Majority of respondents reported that the HDC increased the ability of FQHCs to manage patients with multiple chronic conditions during their routine office visits, acute care, or walk-in visits. The study also examines how FQHC personnel perceive changes in quality care provided to patients with chronic conditions emphasized by the HDC, as well as those with non-HDC conditions. It also assesses where the HDC improves the ability of FQHCs to manage patients with multiple chronic conditions and routine screening needs. Down below this table right here, so the table presents the perceived impact of health disparities collaboratives on patient care provided by federally qualified health centers across the different categories. So, overall, the article underscores the importance of valuing both the intended and unintended consequences of QI interventions like the HTC to gain a comprehensive understanding of their impact on patient care and organizational outcomes. The federally qualified health centers share quite a few policies with the NASW code. They aim to improve access to healthcare services, particularly for vulnerable populations such as Medicaid beneficiaries. This aligns with the NASW Code of Ethics Principle of Service, which emphasizes social workers' commitment to helping individuals in need and addressing social problems. They also highlight the importance of collaboration between federally qualified health centers, private practices, state Medicaid agencies, and other stakeholders to improve healthcare delivery and outcomes. This aligns with the NASW Code of Ethics principle because it emphasizes the social worker's responsibility to work effectively with other professionals and organizations to address clients' needs. It also focuses on reducing disparities in healthcare's access and improving health outcomes for underserved communities. This is consistent with the NASW Code of Ethics principle of social justice, which emphasizes social workers' responsibility to change social injustices and advocate for equitable access to resources and services. So finally, for the discussion question, in what ways could the partnership described in the articles between federally qualified health